How is myositis diagnosed? Diagnosing myositis typically involves a combination of medical history, physical examination, laboratory tests, muscle biopsies, and sometimes imaging studies. Myositis can present with a wide range of symptoms, and the diagnostic process aims to identify the specific type of myositis and rule out other potential causes of muscle weakness and inflammation. Here is an overview of the steps involved in diagnosing myositis. 1. Medical history and physical examination. Your healthcare provider will begin by taking a detailed medical history, including information about your symptoms, their onset, and their progression. A thorough physical examination will be conducted to assess muscle strength, mobility, and any visible signs of myositis, such as skin rashes. 2. Laboratory tests. Blood tests are an essential component of the diagnostic process. Specific blood tests that may be performed include 3. Creatine kinase, CK, levels. Elevated CK levels are often seen in myositis and can indicate muscle damage. 4. Myositis-specific autoantibodies. Blood tests may detect autoantibodies associated with myositis subtypes, such as anti-Jo1 antibodies in polymyositis and anti-Me2 antibodies in dermatomyositis. 5. Complete blood count, CBC. This test can help assess for anemia and other blood abnormalities. 6. Inflammatory markers. Erythrocyte sedimentation rate, ESR, and C-reactive protein, CRP, levels may be elevated in the presence of inflammation. 7. Autoantibodies. Tests for other autoantibodies, including antinuclear antibodies, ANA, may be performed to rule out other autoimmune conditions. 8. Muscle biopsy. A muscle biopsy involves the removal of a small sample of muscle tissue for examination under a microscope. It is a key diagnostic tool for myositis. The biopsy can reveal characteristic changes in muscle tissue, such as inflammation, muscle fiber damage, and the presence of immune cells. Muscle biopsies can also help differentiate between different types of myositis and rule out other muscle diseases. 9. Imaging studies. Imaging studies, such as magnetic resonance imaging, MRI, or computed tomography, CT, scans, may be used to assess the extent of muscle involvement and to identify areas of inflammation or damage. These studies can help guide the biopsy procedure and monitor disease progression. 10. Electromyography, EMG, and nerve conduction studies. EMG measures the electrical activity in muscles and can help determine if there is muscle dysfunction. Nerve conduction studies assess how well nerves are transmitting signals to muscles. 11. Pulmonary function tests. In cases where respiratory muscle weakness is suspected, pulmonary function tests may be conducted to assess lung function. 12. Other tests, depending on the specific clinical presentation and suspected subtype of myositis, additional tests, such as swallow studies or cardiac evaluations, may be performed to assess the involvement of other organs or systems. Once a diagnosis of myositis is confirmed, further tests may be conducted to determine the subtype and severity of the condition. How is myositis treated? The treatment of myositis typically involves a multidisciplinary approach and is tailored to the specific type of myositis, the severity of the condition, and the individual patient's needs. The primary goals of treatment for myositis are to reduce muscle inflammation, control symptoms, improve muscle strength and function, and prevent complications. Here are the key components of treatment for myositis. Medications. 1. Corticosteroids. High-dose corticosteroids, example, prednisone, are often the initial treatment to rapidly reduce inflammation and muscle weakness. After an initial response, the dose is usually gradually tapered to the lowest effective level to minimize side effects. 2. Immunosuppressive drugs. In cases of moderate to severe myositis or when corticosteroids alone are insufficient. Immunosuppressive medications, example, methotrexate, azathioprine, mycophenolate, may be used to suppress the immune system's abnormal response. 3. Biologic therapies. Some individuals with myositis, particularly those with refractory disease or specific autoantibodies, may benefit from biologic agents like rituximab or intravenous immunoglobulin (IVIG). 4. Physical therapy. Physical therapy is a crucial component of myositis treatment. It helps maintain muscle strength, improve mobility, and manage muscle pain. A physical therapist can design a personalized exercise program to address specific muscle weaknesses and functional limitations. 5. Occupational therapy. Occupational therapy can assist with activities of daily living, ADLs, and help individuals with myositis adapt to any limitations in their daily routines. 6. Speech therapy. For those with dysphagia, difficulty swallowing, speech therapy may be recommended to improve swallowing function and reduce the risk of aspiration pneumonia. 7. Pain management. Pain relief may be achieved through various methods, including over-the-counter or prescription pain medications, heat therapy, and other modalities. Some individuals may benefit from pain management specialists. Treatment of complications. Complications related to myositis, such as respiratory issues or heart involvement, may require specific treatments and interventions. Monitoring and follow-up. Regular follow-up appointments with healthcare providers are essential to monitor disease activity, adjust treatment as needed, and manage potential side effects of medications. Monitoring may include blood tests to assess muscle enzymes and markers of inflammation, as well as imaging studies. Lifestyle modifications. Managing stress, maintaining a healthy diet, and staying physically active within one's capabilities can contribute to overall well-being. Smoking cessation is important, as smoking can exacerbate myositis-related lung issues. Supportive care. Supportive care may include addressing symptoms such as fatigue, depression, or anxiety through counseling, medication, or support groups. Nutritional support and dietary modifications may be recommended to address specific needs. Preventing and managing complications. Preventing complications such as rhabdomyolysis and infections is essential. Early recognition and prompt treatment of complications can be life-saving. How can I prevent myositis? Myositis is primarily an autoimmune disorder, and its exact cause is not fully understood. Therefore, it is challenging to prevent myositis through specific measures. However, there are some general strategies and lifestyle practices that may promote overall health and potentially reduce the risk of autoimmune diseases like myositis. 1. Maintain a healthy lifestyle. Eating a balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats can support overall health and immune function. Regular physical activity can help maintain muscle and joint health, improve cardiovascular fitness, and reduce the risk of obesity, which is a risk factor for autoimmune diseases. Get enough sleep to support immune system function and overall well-being. 2. Manage stress. Chronic stress can impact the immune system. Engage in stress reduction techniques such as meditation, yoga, deep breathing exercises, or mindfulness to help manage stress. 3. Avoid smoking. Smoking is associated with various health risks, including an increased risk of autoimmune diseases. If you smoke, consider seeking support to quit. 4. Limit alcohol consumption. Excessive alcohol consumption can weaken the immune system. If you choose to drink alcohol, do so in moderation. 5. Protect against infections. Practice good hygiene, including regular hand washing, to reduce the risk of infections that may trigger or exacerbate autoimmune diseases. Stay up to date with recommended vaccinations. 6. Sun protection. For individuals with dermatomyositis, sun exposure can worsen skin rashes. Use sunscreen, wear protective clothing, and avoid excessive sun exposure when necessary. 7. Medication review. Some medications, including certain statins, have been associated with drug-induced myositis. If you are prescribed a medication known to have this side effect, Discuss the risks and benefits with your healthcare provider. 8. Early diagnosis and treatment. If you have a family history of autoimmune diseases or experience symptoms that could be related to myositis, seek medical attention promptly. Early diagnosis and treatment can help manage the condition more effectively and potentially reduce complications. It's important to note that while these strategies may promote overall health and well-being, there is no guaranteed way to prevent myositis or other autoimmune diseases, as they often involve complex interactions between genetics and environmental factors. What can I expect if I have myositis? If you have been diagnosed with myositis, what you can expect will depend on several factors, including the specific type of myositis you have, the severity of the condition, your individual response to treatment, and the quality of your medical care. Here are some general expectations and considerations for individuals with myositis. 1. Disease course and progression. The course of myositis can vary widely. Some individuals experience periods of disease activity, flare-ups, followed by periods of remission, while others may have more stable or progressive symptoms. The rate of disease progression can also vary. Some forms of myositis progress slowly over many years, while others may have a more rapid onset. 2. Symptoms and challenges. Muscle weakness and fatigue are common symptoms of myositis. Depending on the extent of muscle involvement, these symptoms can impact daily activities, mobility, and quality of life. Skin rashes and other skin-related symptoms may occur in dermatomyositis. Dysphagia, difficulty swallowing, may affect some individuals, while others may experience joint pain or other complications. 3. Treatment and management. Treatment typically involves a combination of medications, physical therapy, and supportive care. The goal is to control inflammation, improve muscle strength, and manage symptoms. You can expect regular follow-up appointments with your healthcare providers to monitor disease activity, adjust treatment as needed, and manage potential side effects of medications. 4. Physical and occupational therapy. Physical therapy is often a crucial component of myositis management. It can help you maintain muscle strength, improve mobility, and manage muscle pain. Occupational therapy can assist with activities of daily living, ADLs, and adapting to any limitations in daily routines. 5. Lifestyle adjustments. Depending on the extent of your muscle weakness and functional limitations, you may need to make adjustments to your daily activities, work, and lifestyle. It's essential to communicate openly with your healthcare team about any challenges you encounter, as they can provide guidance and solutions. 6. Monitoring and awareness. Regular monitoring of muscle enzymes, blood tests, and other diagnostic measures will be part of your ongoing care. Be aware of potential complications associated with myositis, such as respiratory issues or infections, and seek prompt medical attention if you experience concerning symptoms. 7. Support and coping. Living with a chronic condition like myositis can be challenging. Seek emotional support, whether through friends, family, support groups, or counseling. Learn about your condition and treatment options to actively participate in your care and make informed decisions. 8. Research and advances. Stay informed about advances in myositis research and treatments. There's no cure for myositis, but in most cases, treatment can put it into remission. Most people with myositis have it for the rest of their lives. People with myositis have an increased risk of developing rhabdomyolysis. Some cases of myositis can be fatal. Around 5% of people with dermatomyositis die within a year of their diagnosis.